Hi, this is Eric Prystowsky, and welcome to another segment of EP on EP. It's a special pleasure for me today to welcome my guest, Mellanie True Hills, who's the CEO of StopAFib.org and who has personally taught me so much about what the patients think. So Mellanie, welcome to the show.
Dr. Prystowsky, thank you so much for the
Dr.
opportunity.
Prystowsky, really, after all these years?
Dr. Pig.
Okay, so Mellanie, one of the things you've really taught me about, and I think people need to know, but is patient concerns, but in particular, this thing that you taught me about patient-relevant bleeding. So why don't you give me an overview how you came to this and what patients are thinking?
Right. So we were working with a company in the anticoagulation space, and they wanted to understand what patients' perspectives were around the whole area of minor bleeding.
Okay.
And so we did a survey. It was a global survey, more than 3,000 patients, and it was not just AFib patients. We also brought in the National Blood Clot Alliance, and so we had some DVT and PE patients as well. And we wanted to find out what they thought about minor bleeding. And we learned a whole lot. And this was actually presented as a late breaker at ISTH in Montreal in 2023.
So before we go on, can you define minor bleeding? Because most physicians look at GI bleeds and blood loss. So what is defined by your study in minor bleeding?
So what we were looking at is what patients, were dealing with in bleeding that didn't require a trip to the hospital.
Okay.
So that's really what we were looking at, because that's usually what minor bleeding is considered to be, is no trip to the hospital.
Okay.
So we ask patients to share with us about their experiences with bleeding. And what we found was that in this survey, more than 59% had actually experienced bleeding. And of those, 86% had experienced both bleeding and bruising.
Yeah, I was going to say bruising
Yeah.
is a common complaint with my patients.
Absolutely. And bleeding is not unusual as well. And sometimes it may be severe bruising.
Right.
That's, just the bleeding under the skin. And so what we found was that 47% had felt an emotional impact from having this bleeding or bruising, and it made them stressed, anxious, even as much as depressed, fearful, and definitely had an emotional effect on them. What was really interesting is that 54% adjusted their lifestyle because of the bleeding or bruising. So things like decreasing or stopping hobbies, sports, even things around the house, like using a kitchen knife. Then they may have worn clothes to cover up their bruising. And you'll never see me without long sleeves on, because my anticoagulant causes me to be bruised over my arms, my torso, my legs, my back, all over. And so it can be very, very severe as a result of anticoagulants. But then many people even decrease personal grooming, such as shaving their legs, shaving their faces, socializing, and even things like outdoor activities like swimming, because they felt like it was too embarrassing for people to see all the bruising on their bodies. So there were a lot of changes that people made as a result.
So let me, before you go on, this is really a critical issue because our whole concept for a doctor is to improve quality of life, right? So this is antithesis to what we're trying to do.
Yeah.
So we're trying to prevent strokes, and at the same time, we're hurting patients' quality of life.
Yes.
Now, I have a huge practice, especially of AFib patients, and they do bring up the bruising, but nobody has told me they've had a major change in their life's activities. So I don't think they're telling us this. Is that what you found out?
That's completely correct. They're not telling you because they're too embarrassed to tell you what effect it has. What was most concerning to us, though, was that 29% said that because of the bleeding and bruising, they had contemplated stopping their anticoagulants. And a significant percentage of those didn't tell their doctors that they were doing it. And that is what really concerns us.
Yeah.
So we asked ISTH to reconsider the term minor bleeding and ask them to consider calling it patient-relevant bleeding, because for patients, it's anything but minor.
So I think you've really alerted us to an extremely important thing. I know about it because you were kind enough to tell me about the survey. And actually, I now talk to all my patients about it. But it's a bit of a bind for us, right?
Yes.
Because what's the option? Either we stop the anticoagulants, which is not what we want, or everybody gets an implantable left atrial appendage occlusive device. I mean, what do the patients say about that? How many of them actually said we would like to get some left atrial appendage occlusive device because we can't tolerate this anymore?
Well, we didn't get that much, not like we expected that we might. But what we did get was that they were interested in the idea that there are some medications in clinical trials that have the potential for providing stroke prevention without the bleeding risk. And so they were very interested in that. So they were willing to live with the issues in the hopes that there would be a solution to it. But some of the things that were really concerning to us were things like, withdrawing from activities because of this. Younger premenopausal women said that they had to stay home from work due to periods from hell. And then there was a fear of future bleeds, so there was a lot of anxiety. And many just don't tell their doctors about this. That was the most concerning part.
So I think, this is tough. This is a tough one, right?
Yeah.
Because the only thing I see, because I'm not going to want for my patients to stop something that can prevent a stroke.
Absolutely.
You and I spent how many years working on preventing strokes, right?
Absolutely.
So either they go and get a device put in, or the research moves forward that looks and see if you have an ablation for AFib and you're not like a really high chance VAS score, maybe you don't need anticoagulant, or maybe using a mobile device that you wear all the time.
Right.
I mean, those data aren't in yet, but those seem to be the directions. I mean, that you could go and look at pill in pocket technique or something.
Absolutely. That's really important. Or if they find that they really do need to continue it all the time, then they may just have to accept that they're going to have some bruising and some bleeding and just deal with it. Things like wearing long sleeves and covering up and just accepting it for now.
I have to tell you, I don't love that as a solution.
I agree.
I don't, well, because it's just not right to have, if that was, let me put it differently. If I'm giving somebody a drug to prevent AFib that changed their lifestyle in a negative way, I will tell you I changed that drug.
Yeah.
If they tell me.
Right.
They have to tell me. I mean, they'll usually do just like you said. They'll go, look at this, Dr. P, and they'll show me their arms. But they don't go to the next step and say, I want off this, or come up with a solution.
Yeah.
So we do have we have some potential solutions. I think you're the voice of the patient community. You need to tell them to tell us if they're getting to that, because no doctor wants a patient to feel bad.
Exactly.
Then we start to look for answers, right?
Right. And we do tell them that before you make any changes in your medication, regardless of what it is, that needs to be a conversation with your doctor.
Gotcha. Well, this is important stuff. Well, thanks again for being on the show.
Thank you so much, Dr. P.